Diolch, Llywydd. The newly appointed NHS Wales Joint Commissioning Committee met this morning, Trefnydd, and disappointingly voted on a decision to accept the closure of Welshpool and Caernarfon air ambulance bases. And I'm disappointed, therefore, that there is not a statement in this chamber this afternoon or scheduled for tomorrow on such an important issue that affects tens of thousands of people across Mid and West and Mid and North Wales. But also, Minister, it's not just the public that are concerned with this proposal, because in Powys, for example, we have no district general hospital, so we're more dependent on a critical air ambulance service. It's also clinicians, many clinicians based at Welshpool and Caernarfon bases, also opposing the decision as well on clinical grounds. Also, clinicians and professionals across other areas as well. And also, Minister, it's Powys Health Board and Betsy Cadwallader the Health Board that also rejected these proposals as well at this morning's meeting. So this is not just members of the public, these are professionals as well saying that this is the wrong decision. So I'd therefore like the Minister to consider calling in this decision to allow for proper scrutiny and for this decision to be made by Welsh ministers following debate in this chamber. There's also concern about the process as well. Originally, proposals were leaked over 2 years ago to close Welshpool and Caernarfon bases, and at the time that was based on evidence, we were told, that 583 additional scene attendances would be achieved. That has since been discredited, and it seems that since then, the evidence has tried to be found to fit the original proposals made 2 years ago. And I'm appalled at how this process has developed over the past 2 years, a lack of transparency and a lack of listening to the public and professionals as well. So can I ask, Trefnydd, that the Health Minister or the First Minister make a statement to this chamber either today or tomorrow and make themselves available to answer questions to this such important issue to the people of Mid and North Wales.
Well, Joachim, Russell George, and it is important you have had this opportunity today in the business statement to raise this point, because the final decision, as you said, comes after 18 months of engagement, was made earlier today by the NHS Wales Joint Commissioning Committee. Plans will now be developed to consolidate services currently provided at Welshpool and Caernarfon at a new site in North East Wales. And this will mean that currently everyone who receives those EMRTS services will continue to receive care. The change, I mean, obviously you've been involved, as you say, Russell and colleagues, with the engagement. There's been much correspondence setting out concerns and questions, but the understanding is the change will, evidence is the change will improve access to this life-saving service for people in parts of Wales who currently have no or limited access at night. So we understand the strength of feeling expressed by people living in parts of Mid and North Wales, especially in those close to the existing bases. But ultimately, the decision will improve the care and outcomes for people in North and Mid Wales if they suffer a life-threatening emergency which requires the EMRTS support, especially at night. And I think what also would add that the Joint Commissioning Committee has been assured by the Chief Ambulance Services Commissioners that all concerns have been addressed through correspondence with the relevant parties. And the Cabinet Secretary for Health and Social Care has received written assurances from the review team about the level of engagement undertaken and how local residents' feedback has informed the review process.